Thank you, Ryan. Appreciate it. Want to kind of give a couple of heads ups and a little kudos to some people before we start this. Kathy has done some amazing things within the athletics department. She is our Title IX coordinator through athletics. She works directly with Sharon Nolan Weiss and a lot of diversity and inclusion things. And I also want to mention that we, as a university, as an athletics department, received a very honorable award this past year in diversity and inclusion through the NCAA. And that is a direct benefit from Kathy's hard work. She's very, very integral in everything we do. When I first got on campus, she was one of the first people I met, and has helped me ever since. And that kind of started this whole inclusion policy of transgender student athletes. To kind of give you a little background of this policy, we had a student who was questioning whether they wanted to be a varsity athlete or not, but was of transgendered nature. And we don't know the details of it because it never really fully enveloped or developed into something. But wrote an email to the coach and said, "Coach, I want to be a part of this team. However, I don't know what it is, how it is, what I do because I am a transgendered individual." And of course, coach doesn't know because this is a fairly new concept of being able to bring these people in, bring everybody in and include everybody in varsity athletics. And so coach took it to senior women's associate Kathy, who is also our diversity and inclusion person, and said, "What do I do? How do I do this?" And of course, Kathy, being the proponent that she is, said, "Well, let's do some research and find out about it." And so she and I talked, and I had been on the job a month maybe, and it was one of the first tasks that we worked together on and did some research on it. And the NCAA has some really great resources for diversity and inclusion. They're very, very inclusive in every population, no matter who you are, what you are, where you are. And so we tailored a lot of our information from what the NCAA says. Now, we were talking a little bit ago about the University of Buffalo safety zone training and the different things that we do on campus here. And by all means, you know, Kathy's going to get into a little bit more of that, but by all means, this coincides with what they think, what they want, with how they work with things. And obviously, if there's questions there, Kathy's a really great resource for that. So taking a look at this inclusion policy, when we're looking at the objectives, there's a lot of different terminology out there. There's a lot of nomenclature. There's a lot of, well, what does that mean? Some of it I have no idea. Some of the, in the safety zone training, there were terms in there that I had no idea about. And so one of the things we're going to talk about is what does truly transgendered mean? And when we're looking at it, what Kathy and I are looking at it from the athletics side of things is from a lot of medical and personal care. It's not necessarily what you want to be named or called, but it's more of making sure that we're giving the people the proper care that they need. We're going to talk a little bit about the NCAA standards. There are some boxes that need to be checked so that they know exactly what's going on, what to prepare for, and make sure that we have a level playing field for all student athletes that are out there. One of the big things that the NCAA is keen on is performance enhancement. Is somebody have leverage on somebody else because of something, whether it's hormone therapy, whether it's unfair advantage doing other things. I don't know. But then we're going to take it from what the NCAA told us we need to do and how do we incorporate it into University of Buffalo? What resources do we have that we can oblige what the NCAA says we have to do, but also to make people feel comfortable, to make them feel like they want to be a part of varsity athletics with us. Not only the university. The university is a big thing. We want to make sure that everybody's welcome here, but as long with varsity athletics, because that's kind of the main focus of our lives. We talk about best practices for accommodating student athletes. There are certain things that different athletes need: privacy, confidentiality, those types of things that we have to respect and make sure that they are getting the best care that they can and not being bullied or retaliated against or anything like that. And finally, we'll talk about the resources that the university and the NCAA have. So that's just kind of an outline of what we're going to talk about today. So when we look at transgender, there's a lot of different things out there, but transgender is someone who truly was born with sexual characteristics of one gender, but wishes to be recognized in the other gender. We have male to female, or MTF, which is going to be key in the future. Male to female, born with male gametes, and wishes to be recognized as a female. Female to male, same type of thing. Born a female, female characteristics, but wishes to be recognized as a male. And For the future, just MTF, FTM, I wanted to make sure that you guys understand. We're going to talk a little bit about those shortly, but that's the shorthand for what they mean. Okay? When we talk about transgendered individuals, interesting story, funny story. Back in 2003 when I was in grad school, one of my good friends was teaching first aid and CPR, and first class he ever taught, he'd been on campus about a week and a half, and he's teaching this basic first aid and CPR class, and gave us syllabus because they provided us syllabuses and said, read this to the people and go on with it, and that's how you start your class. Well, did that. Of course, he was nervous, he's shaking, and first time he's ever taught in front of 125 people. And after class, a person walks up to him and says, you said my name is Jennifer, and on the roster it's Jennifer, but I'd prefer to be recognized as Jeff. Okay. And said, I'm a transgendered individual. This is how I would, legally my name is Jennifer, but I'd like to be recognized as Jeff. And of course, he had no problems with it. He's like, I really appreciate the fact that you came to me and told me that, so I'm not yelling out Jennifer and you're looking into space, because that's not how you're recognized. And so people of transgender can identify themselves with different names, whether legally changed or whether a nickname, self-referencing pronouns. He also asked to be referred to as a he, and that's fine. That's the way they recognize themselves, and that's the way we want to recognize them as a society. Okay, clothing style changes. We talked a little bit about the hormone therapy. Male to female will do some hormone suppression. It will also look at doing estrogen treatment. So there is some hormonal manipulation, I guess, for lack of a better term, to enhance their recognition of being a male to female or a female to male. Now, a female to male may take testosterone. And testosterone is also a performance-enhancing hormone that the NCAA recognizes as a banned substance. So when they're looking at participating male to female or female to male, you have to understand what hormones and what chemicals they are taking to ensure these changes. Now, these changes have to be recognized medically and documented medically for them to be recognized by the NCAA. The other thing is there's surgical procedures, there's enhancements, there's gender changes, there's different things that can occur. So when you're working with a transgendered individual, you want to talk to them about how do you want to be recognized? How do you, respect yourself? How do we respectfully talk to you in an appropriate manner that you feel comfortable with? And so when we're working with identification, those are the things that have to be thought of and talked about. Not to be confused with, a couple of different things. People are born with both sexual characteristics. We have females that have a higher testosterone level. That's just the way they were born. We have males that have higher estrogen levels. That's the way they were born as well. There's different genetic abnormalities or genetic differences that they may naturally be born with. That doesn't mean that they're transgender. That's just the way that they were born. Sexual preferences, homosexuality, bisexuality, any of those types of things. This is not what recognizes transgender. Transgender is recognizing you as the person wishing to be known as male, female, whatever it may be. And style choices, if someone chooses to wear, whatever they want, that doesn't necessarily mean that they have a transgender identity. That just may mean that, hey, okay, I really like skirts and that's the way it is. Or it may be that I prefer to wear jeans and be comfortable with it and it doesn't matter. Okay, so not to be confused with those, we're talking truly a transgendered person who wishes to change their lifestyle to the opposite sex. Just to make sure that that is clear and understandable. Now from the NCAA, they started recognizing some of these things a long time before, Kathy and I sat down in 2015 and worked on this. The basic premise of all of this is that the NCAA wants to include as many people as they can to be athletes. And they want it to be equal, they want it to be fair, they want it to be fun, and they want everybody to be able to participate. Now this participation, obviously, from a medical standpoint, needs to be equal, and from a playing field needs to be equal. And so this is what their Office of Inclusion. We have this specific quote on our transgender policy, and what it does is it was adapted a little bit. At the end, it did say learning environment at UB for all student athletes and enhanced excellence. This is their general guideline that they want us to have. And in 2011, they came out with an official statement. And the link to it is towards the end of the presentation. But this is their official stance and their official state on what they want to do and how they want all universities that are involved in the NCAA to respect and identify transgender. Okay, so along with this, inside the NCAA policy, when we're looking at a female to male, which we've talked about, they may be taking some hormone therapy of testosterone. If they're receiving no hormone therapy, they may participate in men's and mixed sports teams. Okay, because they are wanting to recognize as a male, that's the sports that they may focus on. Okay, if they begin to receive some testosterone therapy, okay, great, as long as it's medically documented and medically accepted, wanted, needed, then they may still participate in men's and mixed sports teams. Okay, the caveat is they may not participate in a women's team from the minute they take the testosterone therapy forward. Okay, testosterone is seen as a performance-enhancing drug. It's a growth hormone that the NCAA does ban. So they may not ever, according to the NCAA, they may not ever participate in a women's sport again because they have had that boost of hormone or boost of growth or performance enhancement that may not allow them to, or may allow them to have a disadvantage to women participating in women's sports. And that's a harsh line, but if someone is making that decision, that just kind of solidifies that they're making that decision and they need to stay with it. From an NCAA perspective, it does create fair play, and it does create a level playing field for everybody. You know, if it's 5 years down the road, they probably aren't participating in sports at a collegiate level anyways, you know, and that's one of the discussions or arguments as well. If they stop for 4 or 5 years, it's completely out of their system. Well, you have 5 years to play 4 seasons, and so after 5 years, your eligibility is up anyways. So it doesn't necessarily matter long term, but if you want to participate in NCAA sports, you need to abide by their rules.
Swimming be considered a mixed sport team?
No, so when they talk about a mixed sport team, they're talking about like a team effort where there is men and women. Like, and I don't have really any good examples because we don't have any here. It would be more of a like a rifle or equestrian, or where you have men and women gaining points together for a team score. It's not necessarily men's swimming versus women's swimming where you're still getting individual scores there. It's a combined team effort. And I don't have any really good examples of sports because there's not very many. You know, I think there, and I don't quote me on this, but I think there might be a mixed rugby team, but I don't know that for sure. Bowling is definitely a possibility, absolutely. You know, that's a good one, thank you. So when working with female to male, you have to be very careful. You have to make sure that everything is documented, because if testosterone is introduced, it changes the course of their trajectory in NCAA sports. Okay, so if they are truly wanting to do this, they have to understand that these are the steps that are going to be taken. Okay, now when we're working with a male to female, males that are transitioning into females, no matter what state they're in, they may be able to take some testosterone suppression. Okay, if they are in the process or have not taken any testosterone therapy, they are not able to participate in women's sports. And this one is a little bit more complicated because there is a definite argument for if you're taking, you know, suppression hormones or if you're taking estrogen hormones, why do you have to wait a year before you can participate in women's sports? And I've not been in the middle of this discussion, but I have seen, you know, people discussing, well, why can't I? Why should I not be able to be recognized truly as a woman and participate in women's sports? And it goes back to the testosterone levels. It goes back to the testosterone suppression. You know, if you're taking testosterone suppression, you can be in a men's team or you can be in a mixed team. But you cannot be in a women's team unless you have had 1 complete year of treatment. Okay, and I'm sure there's a lot of arguments with that. And it would be interesting to see and hear the different sides of it that want to present it and talk about it. Okay, but transitioning from a male to a female, if you are taking testosterone therapy, you can participate in a women's team after 1 calendar year. You can still participate in men's teams, and even if you discontinue the testosterone therapy or the suppression therapy, you can still participate in men's sports. Okay. Now, from a university standard, I'm going to let Kathy take over. She is one of our she is our senior women's administrator, and she has had a lot of discussion with all the different departments to how to handle this at the university perspective. So I need to.
Okay. Like I got a holster on. As I said, my name's Kathy Twist. I'm the Senior Women Administrator and also Senior Associate Athletic Director for Sports Administration, meaning I have my hands in pretty much everything in athletics. And as I was introduced, it is true, I have a Bachelor of Science in Nursing. And for undergrad, I went to Geoville College right here in Buffalo. And don't add up the years, but you know, I worked about 20 years here at UB, but I worked in area hospitals for 17 before I became with this position. I worked burn unit, ICU, medical and surgical. I worked hemodialysis, and I worked in allergy testing. So, and I loved it. I think you have one of the most noble professions that someone can work. So, one of the things I want to talk about is, how we really take care of the mental and the emotional being of this particular student athlete. Brian laid out the physical, and I will tell you, when I went to nursing school, I thought everything was just the physical. You know, you look at the labs and the X-rays and all that, you put it all together, you say, this is the health of the patient. But one of the things that I did learn, that the mental and emotional, if you take care of that, that's a lot of the healing process. So I took that thought with me as I work in athletics, that we take care of the whole being of the student athlete. And when someone comes in that's thinking about transgender, like we get that phone call, like, what do I do? The most important thing, we say, come on in, talk to me. What would you like to do? And I think that's good to remember for your patients too. Talk to them. What are they expecting? What do they think about what's happening? You can really start pinpointing where to go first with your priorities. But I think that's very important, to really listen to the person that's in front of you. So, when they start that conversation, I'll ask them, are you thinking of taking hormonal treatment, or what have you thought about that? And then once I get some information for the physical part, then I contact Brian, and I also contact, I'm supposed to, for the NCAA, saying I have a transgender student athlete. Here's the program that we're going to be doing, and they'll want reports and everything from us as to whether it's male to female or female to male, how they're progressing. And they're also going to want to know, are we making accommodations for this particular student athlete? So let's talk about some of those accommodations. One of the things that we're really focused on is that our staff needs to be educated, because you are the leaders. You're going to set the tone for this student athlete. So, we have them go through a mandatory course of intersections that's on UB Edge. If you're in a reporting area, then you have to take the Clery Act from the University Police Department that gives you that. So we make sure that Safe Zone too. If you haven't gone through Safe Zone, it's a really great course, and you get into all the nitty-gritty, that the little nuances that are really important to transgender or LGBTQ community. So I would encourage everyone to do that. You got to have an educated staff, because they're going to be your foundation to teach your students, right? So one of the things that we impress upon people is the safety of this student athlete. Why? Transgender as a group is one of the highest homicides of that particular group. I think it's 1 in 12. And when you really look at the statistics, it's women of color, that are really targeted, and that number is not going down. It's going up, surprisingly. But so safety is one thing. So we talked to our, how do we make them safe? Well, they're going to be using facilities, right? Whether it's bathroom, whether it's changing areas. I always say, what do you feel comfortable with? What do you need? So we'll make those accommodations to you, but tell us what you need, because some people don't really care. Some will just keep it the way it is. I'm fine. Okay, let me know if something arises that you would like us to change. So you want to have those conversations. Also, competition at another school. What do you do then? You got to be careful of HIPAA and FERPA laws, right? Okay, so I can't call up another school and say, hey, we've got a transgender student. his name is, make sure. I can't do that. I just say I need special accommodations for a certain student. No name, no reason, okay? And if they don't get it, I just kind of keep pressing the issue. I can't, because of those laws, tell you why, but I need a special changing room and these other accommodations for this particular student athlete. So you have that conversation, across other schools to make sure that they are going to be safe wherever they're going to go. Language. Brian mentioned, using the proper names, pronouns, ask them, what name do you want to use? This is very important to them. Again, it's that emotional, mental that you're taking care of. This transition for them, I don't know if you can imagine, it's not easy. But it does help when someone recognizes this is who they want to be, right? And I just think that's everybody's right. The closer you are to your authentic self, the healthier you are. The more layers that we have to put on and not be ourselves causes stress, okay? So, this gets them closer to being their authentic self by using pronouns or the name that they expect to use. Dress. We shouldn't say, what are you comfortable in traveling or competing in? So we have those conversations. We don't want them to dress against their identity. I will tell you, most of us are in sweats, which I'm, glad I dressed today. I'm not that I would be in sweats, but if we're being recorded, I want to make sure I look a little professional here. And then I guess I want to say something about enforcement and non-retaliation. I was talking, I think it was to Courtney here. I call Sharon Nolan Weiss because I want to kind of hopefully transfer some of this information to the clinical area, right? So, you are nursing students. If you have a question about ECMC or Millard Fillmore where you're going, and you're not sure if this person is being treated properly, HIPAA laws or New York State laws, you can call up our equity, diversity, and inclusion, our Title IX people here, and they will help you to help that particular patient or any questions that you will have about laws and what to do. So that's kind of a nice reference for you. I would suggest, though, if you do go into the hospitals, read their policy. Do they have one? I also was talking to Courtney that when I came on in 2012, we had no policy on transgender sexual harassment or LGBTQ. And all my colleagues were saying, you don't put anything up there, then you're going to be liable. Well, working with Nellie Drew in the law school, she goes, you're going to be liable if you don't have anything up there. So hospitals, even private, should have some kind of policy. If they don't, then you can refer to Title IX on UB campus. I think that's pretty much all I wanted to say about the student athlete and transgender. I think from a hospital standpoint, you don't do grand rounds anymore. However, you do reporting from shift to shift, right? I think that's when the education can occur. So if somebody starts making fun of this particular, oh, by the way, room 212, is transgender, ha, ha, ha. Well, that's when really you can start the education right there. Because again, this is a person. And they're looking to be treated with dignity and respect as they're going through this. So you want to make sure that you're educating the people around you, to make sure that they're understanding this is a person, not a thing, not a surgical procedure, right? So I think just in rounds, or not in rounds, but in your the way you talk, the way you treat this particular patient, anybody that comes in, whether it's an X-ray technician or someone taking blood work, just say, make sure that we're treating this person with dignity and respect. Yes. Great question. I'll take you through the way I approached it. Since we didn't have any policy, that was the first thing. Because as Brian said, we had to sort things out. What was the right way to do things? What are the best practices out there? And then you can start making a policy. Now the next thing is, how do I implement that policy? Is it through education? Is it through communication? Somehow you have to have that kind of statement that everybody gets, right? You saw the statement that we're going to treat everybody with respect and dignity. So that's how it would start. Policy, then, education, the communication part of it, so everybody is on board. And then the nitty-gritty, as Brian said, I work with every unit in the athletic department. So I work with facilities. Do we have a standalone bathroom that anybody could use in case they want privacy? Do we have curtains up in the shower? Might they ask for that, right? Or do they want a cubicle for their own changing area? So that's when you get into the nitty-gritty of facilities, which is still important, right? Because they might want some privacy as they're going through this. So that's how I would answer that question. Policy, education, communication, and then facilities. And the last thing is, decreasing the retaliation. How are you going to deal with people that don't comply with your philosophy and your values? And, you have laws. I know the military has its own laws, but you do have laws, New York State federal laws, on how people should be treated. You can always fall back on that if you want to bring someone up and say you're not following policy here. Does that answer your question? You're welcome. Any other questions? Yes. Right. Well, there are some documents you cannot change. Like Social Security right now. We're going through that transition, and Margaret probably speak to this too. We're going through this transition at UB as far as what names to use and can we use them on transcripts and things of that nature. Now you have HIPAA and you have FERPA. FERPA is the documents for school, right? All your transcripts for school. That you have to be very careful with that because you couldn't put something on there. I know that athletics, somebody was sued because you can put that someone was dismissed for misbehavior on that transcript, right? Now, if somebody doesn't want that released to another school, you can't, So you have to be careful what you put on these records. And then if the person wants it released, they have to sign a document. If they don't want to release, then, they can say what they want and what they don't want on it, right? Because FERPA allows you to look at the document and say, I kind of want this altered. Sometimes you can't from school to school, but names certainly you can. Yes. Yeah, it's very minimal. I don't know the exact percentage. Like we haven't had anyone. Us 2012, someone did call us, and that's how we got going on this. But we haven't had any transgender student athletes yet. But again, to your point, we want to make sure the education, everything's in place. I don't like when something happens and we have nothing. We're scrambling, right? So that's why I say do these things ahead of time, because even if it's not perfect, you have something in place that's a best practice as we know it, and then you can take off from there. So I would say the percentage is very, very small, but you are right. There's more, I don't want to say freedom, but more awareness. I think this generation is more courageous. I think, they're kind of demanding. I want to be who I want to be, and I like it. I think that's great. So I think we're going to have to address a lot of these issues. So again, I would be prepared. Yes. Yeah, and I'll extend that a little bit too. When I took Safe Zone training, the instructor walked in my office and she said, "Oh, this is a friendly space," and I had no idea. I had Billie Jean King up there because I'm a tennis player, and I just like Billie Jean King. But again, what does she represent? So she went around the office and things that I didn't even realize, and now I do it consciously. Now I put things up so people are aware that I am open to discussions. And a lot of people, and I want to do this, put in their address, at the, the signature, they pronouns, he, she, they put the pronouns right in there. And that signals to people that I am, open to listening to this, or you can come in and talk to me. It is very important to them, LGBTQ or transgender, to get these cues. So if you are an administrator or you happen to have an office and you want to be approachable, then put those things in your office. Those are cues to make them feel safe because they know that you're okay. Remember, especially when you're quote sometimes sought out for bullying and all that, they're looking for those cues again to feel comfortable, to feel safe. and then to start the process with you. Yeah, Margaret, just I'll add to that, Brian. When I went to the inclusion summit, NCAA, it was 2 years ago, they were questioning it, like why a year? Because if my labs come back, a certain way, why do I have to wait a year? And to Brian's point, you only get 5 years usually to compete, So that is being questioned. I don't know about legally yet, but they have questioned the NCAA, why a year? Why did you pick that when, I could do my labs and show you that that I'm a woman now, Right. That's a great point, right? And I think that's for the nursing profession as well. When I worked, emergency room, and I knew there was a gang war out there, I knew that people were coming in that, they were shooting each other, and you suspend all that and you just get to work because people are counting on you. You can't be judging people that come in through those doors. Who am I going to take care of? Who am I not going to take care of as well? You just do what you need to do because that's what you promised to do. And that's, they're counting on you. So I think that's a good point. Athletics is challenging because Brian will tell you, we're with our student athletes 20 hours a week plus. I mean, when Brian traveled with the women's basketball team for the Sweet 16, right? Well, we were on the road, 3 weeks? There you go. I mean, you're eating, dinner, breakfast, lunch. You're in the same hotel. They get very, very close to you. And, they sometimes pick out an athletic trainer or an academic advisor or a strength and conditioning coach, and they'll tell you things that they don't want repeated, right? And, we always tell the student athlete, look, if there's a danger to yourself or others, we have to report that. So if someone is depressed and starting to talk about suicide, then we have to let somebody know, okay, because we need to take care of you. But it's very difficult, and you don't want to share that information. It's a judgment about what you share, right? Sometimes in your own head you're like, is this something I should really think is a danger sign, or do I let this go? And the student athletes do get attached to you because sometimes you're the only person that they feel comfortable that's listening to them, that can do something for them. So yeah, that gets a little tricky sometimes. If someone does have severe depression or has attempted suicide, we have a students of concern so that we have enough eyes on that student athlete that if something, something doesn't sound right, we are all alerted to kind of keep an eye on that student athlete. Difficult to keep confidentiality, for people know, right? But we find that it's healthier for the student athlete if people know that this person is depressed right now. If there are any signs that this person is worsening, we need to know. And so far, so good, because we don't want to lose anybody that we could have intervened, that situation. So that's a great point. Yes?
Kind of just training student athletes.
Right. Well, we do that. I always say it starts from the top, though. You have to make sure they understand what your values are. But we do bystander training. We talk about sexual harassment, respect and appreciation. And we have our SAC, our Student Athletic Council. I also have something called the Diversity Athletic Council. And to me, it's like a learning community. I have my core members of that particular group, right? People that are really passionate about all, including all people, right? But along with that, we have my LGBTQ student athletes. We have maybe people with disabilities. And if you remember taking a knee, right, that really kind of involved men of color. So when that happened, I wanted to get ahead of it. And I said, okay, let's talk to the football team because that's who was in the news at that point. And, there's 100 of them. And we went in and said, how do you guys feel about this? And it was a chance for them to really express what they wanted to express. And I think that's the point. You have to ask people, what's going on? Because I can't make a policy up here like no one's kneeling when, they may feel differently. So, talk to me about this. What's going on? So, and I will say it was pretty much, the white student says, my you know, my grandfather fought in the war and all that, so then I can't take a knee. And then, you know, the men of color were saying, you know, it's a little different for us. You know, and with the perspective, shared perspective, was education in itself. And, you know, seeing from somebody else's eyes, you know, okay, you don't want to kneel. I get why you don't want to kneel. But we might want to make a statement here. So, you know, in that case, we just said, we're going to allow you guys to decide what you want to do. Because, you know, and then we'll support that. So I think the education, like I said, you can write your policy and everything. But the education is really when policy starts being used, you know, and your values start coming through in situations. When we have situations, we try to make them educational. In other words, how do you guys feel about this? What are you thinking? What do you want to do here? Not many places do that with student athletes. And if you don't, I also study everybody else, you get yourself in a lot of trouble because you're making policy that just doesn't fit. And usually they know what they want to do. And it's, you know, I trust that they've made great decisions. And sometimes decisions that have opened my eyes to handling something better. So, you know, the culture begins by saying, sustaining judgment and saying, what do you think? Because when you start saying, what do you think, people start thinking about what they're doing, how they're acting, and what they're feeling about something. And then when you start bringing that out, they start talking about, you know, like our men of color saying, you know, when you guys get, meaning our white athletes, when you get stopped by a policeman, you're trying to think about, how am I going to talk myself out of this ticket? When I'm a man of color and I get stopped, I'm hoping I only get a ticket. And that was a revelation to our white student athletes. We didn't know that. I'm starting to understand why you might want to take a knee. So I hope that answers your question. But the culture starts by respecting and appreciating everyone's opinion. You may not agree with it. It may not fit your policy. But if you have that culture that we're going to work on it together, and that's what I impress upon our DAC, our Diversity and Council, no matter how much we're going to disagree, you know, it's not going to divide us. We'll come to some solution together that we can all live with and work on it towards a better place, right? But it's not going to divide us. I think a lot of things in the news now want to divide people. So we made a pact. It's not going to divide us. We'll work on this till we get it right. Right. And, you know, we started hashtag Spirit Day for LGBTQ, and that is around a volleyball game. And, you know, we put up, we have a speaker from the LGBTQ community, and usually it's talking to families that come and saying, I knew when I was 3, you know, and I didn't know how to handle that. And you have parents and maybe youngsters that are 9 and 8, you know, that are thinking, I'm a little different here, but they're seeing someone and talking about it. The other thing we do is our student athletes are fantastic. They've kind of picked this up, you know, and I think this generation, again, is the most diverse generation ever. And I think a lot of barriers are breaking down. You have the other side maybe, you know, coming against that, but I think as a whole, on the UB campus, our student athletes are breaking down these barriers. They had a whole week of diversity and inclusion that they took all their information to the mall, you know, where everybody walks around caping. It was a nice day then. And one day it was mental health. The next day it was LGBTQ. The next day it was religion. So they went on, and each day had a theme. And they would, you know, bring the mic and videotape you and say, what do you feel about different religions? And they would put it up on Twitter. You know, they're smart enough to know that let's get to a wider audience about, and they didn't alter what anybody said. They just put it up there. They just wanted to know. So they're picking up kind of what the leadership started, but, you know, they're running with it. So I don't stand in their way on that. You know, I just maybe look at things and say, what do you think about this? And they say, oh, that's a good idea. And I let them run with it. So I hope I'm understanding you right. You remember learning communities that, I think we're learning communities that I envision, you know, there's concentric circles. So you have your core, like I said, they are the advocates for everything, you know, but then around, I have the LGBTQ, and they get together. And then you may have men of color, and they get together. You know, because you do need to talk about your identity and help find it, right? And then bring it back to the general group, right? And help them, you know, understand or whatever you want to share with them. So that breaks down a lot of barriers. And I always say that, you know, emails, Twitter and all that, they're great, but you have to be sitting across from one another. You have to be able to, you know, understand when, you know, a woman of color says, you know, I'm not called on in class. The professor knows I'm the #1 student, but I'm not called on in class, even if I raise my hand. Or, you know, even at a supermarket, you know, at the meat counter, I'm standing there and I'm invisible. I guess you could look at it both ways. I don't feel like, you know, one is off to the side. I think, you know, you have to find a comfort zone too, right? And maybe share what you know, you're looking for as a group, as that particular group. But I think eventually you got to bring it back to the main group and, you know, and help us all understand, you know, what you're going through. Because I think that's how things are. Some people are not aware of what people are going through. And I think that's the problem. I have no idea what, you know, a man of color goes through unless you talk to me. And then I can start doing something about it, you know. Like I understand now why you guys want to take a knee, because you talk to me about it. Because I'm not experiencing that. Does that make sense to you? Or, okay. So I think that conversation has it, and it takes a lot of courage for, I think, a minority group to say something, right, about how it's real. I'm a woman. I always say I'm half privileged. I'm white, but I'm a woman. I'm in athletics. That's a male-dominated profession, right? So there are some things that I don't feel comfortable sharing yet with my male counterparts. But I get together with the women and we talk about how we can break through those barriers, right? And I do tell certain men in the profession how I really feel, because I need their feedback. How would you handle this? Because you're in it. You understand it, the psyche. So help me understand how I can move in, how I can break. So you understand what I'm trying to get at? Those conversations, I think, have to be had. So, yes. Yeah, I find a lot of bullying takes place online. And so, you know, we watch all that. So I have a Twitter account, I have a Facebook account. I don't really use it, but I want to see what everybody else is. So we have had that situation. And what we do is, you know, you first call in that person that put that out there and say, you know, what exactly, you know, are you trying to say here? Because this is how that person took it, you know, and then we don't accept that. So, you know, if they don't get it the first time, you know, we have team rules that they may be suspended. And then, you know, if they're just not getting it, they may be let go. So, again, you know, circumstances, but we don't want to allow that. And we have had circumstances where I call in that particular person and say, this has to stop. This is not what we're about. You're hurting another individual with this. And, you know, so most times they get the message because they know that we'll move on to the next step.
Campus resources as well as NCAA resources. I think we have some really cool opportunities on campus. And when we were talking about the NCAA things, these are the resources. They have a whole handbook, and it's digitally online. It's a PDF you can take. There's another one that's really influential on things, the mind, body, and spirit harassment and discrimination. And it talks about guidelines, talks about best practices, it talks about also NCAA mandates. You know, there are certain things that they suggest, and there are certain things that they tell. And so you just have to be ready for those. So
I think that's it. These are on our website if you want to take a look at them. Like I said, it should be easily found. It's got its own button, diversity and inclusion. So if you think of something to add to this, I'd be happy to, you know, add it. We are always trying to make things better. And things are always evolving. So, okay.
thank you, guys.